In this video, you'll learn how to decode nursing exam questions using clinical judgment so you can stop second guessing and start seeing exactly what the question is asking you. We're going to break it down, looking at the cue, analyzing what it means, and building the right hypothesis before you ever look at the answer choices. Let's get right into it. Before we walk through the decode, here's the part that most students miss. Nursing exams today aren't just about testing facts, they're testing your clinical judgment. This means that every question is built around a cue, a meaning, and a priority. When you understand that structure, the question stops feeling random and starts to make sense. And stay with me, because at the end of this video, we'll break down an example together so you can see exactly how this process works in real time. Your first step is recognizing cues, the small pieces of information the exam intentionally wants you to notice. It might be a shift in vital signs, a new symptom, or a phrase like, the client suddenly reports. Exam questions give you plenty of background information, but the cue is the detail that signals the change in the client's status. Finding that one shift is your starting point for understanding what the question is actually about. Once you've spotted the cue, your next step is analyzing it, asking what that detail means for the client. This matters because the exam isn't testing random facts. It's testing whether you can interpret the direction the client is heading. If the cue suggests worsening, improvement, or a new concern, that interpretation guides the rest of your reasoning. When you understand the meaning behind the cue, the question prompt and answer choices begin to make a lot more sense. After you understand what the cue means, your next step is prioritizing hypothesis, identifying which potential issue could cause harm the fastest if it isn't addressed. You're not choosing the answer yet. You're narrowing your focus down to the concern that needs your attention first. Exams test this because safe nursing care always begins with recognizing the greatest risk. And once that priority is clear, the correct answer usually becomes the one that aligns with that immediate need. Now that you have the three core steps, recognizing the cue, analyzing what it means, and identifying the highest risk concern, this is where the question starts to make sense. These steps give you a clear picture of what's happening with the client before you even look at the question prompt. This is the foundation. The answer choices feel more manageable now because you're looking at them through a clinical lens, not scrambling to guess what the test wants. And to show you exactly how this works, we're going to walk through a real exam style question together next. Here's our example. Take a moment to look at everything the STEM gives you: the client's age, their recovery status, the physical therapy schedule, the pain medication, and even a set of mostly normal vital signs. Most of that is background information. What actually stands out is the oxygenation saturation of 91% on room air and the client reporting that they feel more tired than usual. Those two details signal a change in the client's status. That's your cue, the detail that tells you something may be shifting clinically. Now, let's look at what the cue means. An SpO2 of 91% tells us the client isn't oxygenating as well as expected. When you match that with the new fatigue, you're seeing early signs of decreased oxygen delivery. We're not diagnosing anything here. We're simply recognizing that the client may be moving in the wrong direction. That interpretation sets the stage for what the question will expect you to prioritize. From here, we prioritize hypotheses by identifying which issues could cause harm the fastest if it isn't addressed. With a dropping oxygen saturation and new fatigue, the most immediate concern is impaired gas exchange. Pain, age, and activity level are normal factors in this scenario. But impaired oxygenation is the detail that changes the client's safety. Focusing on that priority guides your thinking before you ever look at the answer choices. Now, let's bring in the actual question. Based on the information provided, which action should the nurse take first? Because we've already identified impaired gas exchange as the priority, we know the correct action must address that specific risk. And when we look at the options, the only response that aligns with that priority is encouraging the incentive spirometer. That action directly supports ventilation and improves oxygen exchange. Option A delays care and doesn't address the oxygenation issue. Option B increases the client's workload of breathing, which could make the problem worse. Option D focuses on pain, which isn't the immediate concern here. This is why decoding the stem matters. Once you understand the cue, its meaning, and the most urgent risk, the correct answer becomes so much clearer. You just walk through the full decode, recognizing the cue, analyzing what it means, and identifying the highest risk concern before looking at any of the answer choices. When you follow this process, exam questions stop feeling like puzzles and start feeling like clinical decisions. In the next episode, we'll take this same framework and apply it to prioritization questions so you can quickly determine who needs you first and why. I'll see you there.